It is my pleasure to announce that we have resumed standard level inpatient surgery at the Marion VA Medical Center. Examples of standard level surgery include hernias repaired, appendectomies, and other procedures that require an inpatient stay. We have made significant progress and have completed successful internal reviews and external reviews resulting in full accreditation by the Joint Commission. Veterans will be happy to know that their care will be managed by the VA healthcare providers, that this will improve their experience by having the procedure and follow-up available at the VA. We want to thank the veterans who come here for their care, and I want to thank the veterans who are out there that are not receiving our care and encourage them to come and see the VA. We'd also like to thank the community for the support through this time. We are also very pleased to announce that the Medical Center is designing a $13 million project to relocate and expand the operating room and emergency departments. And we have the posters here to show what that expansion might look like with these early renderings. And that's my announcement, but be willing to take questions.
How are you going to make sure that you prevent what happened 3.5 years ago from happening again? What new policies, procedures do you have in place?
Procedures are put in place to ensure that we have good oversight, making sure that if something does happen, we're very quick to the draw. But our whole goal is to put systems in place that prevent these things from happening early in the stages. We don't want them to ever happen. We've got staff that are very well trained and prepared to nip in the bud any concerns that might occur during any kind of surgery.
Can you give an example of what those systems might be that are now in place that possibly weren't earlier?
Sure. An example of a system in place to identify our surgeons. We've got credentialing and privileging, which identifies before the doc comes to us that his background experience meets our needs and look for any issues there. And then once they're here, we are going to constantly review their performance, making sure that they are on target, as well as any continuing education. Recently, when the Joint Commission was here, they identified that our process was a best practice in the nation.
There have also been some staffing issues before that were brought up in terms of a number of people available on staff. In the simplest terms, someone who might have been here before, a couple of years back, might have had a bad experience at the hospital due to staffing. What are they going to see today that's different? How is the staffing being addressed, and what does that look like to a patient who's here now?
Staffing has been significantly increased. I think the numbers are about 800 to about 1,300. We have 1,300 now. That's a big jump. So they will see more staff. One of the things that we are really working on is to be patient-centered, making sure that whatever we do revolves around the patient, his family, and make sure that he's involved with it.
You said more staff. Did you get rid of some of the old staff? Did you clean house?
There was plenty of turnover that did occur, yes.
Can you get specific?
Not really about personnel actions, but there has been changes in staff, yes.
What exactly was determined to be the problem in the first place? I know that we reported that you guys settled with family. What were the main issues?
There was some concern about surgeries that were being done that exceeded the scope of the providers, and that when they do that, the rest of the hospital is not in position to support them. And those things have been addressed.
In what ways?
By making sure the staff is prepared. We have the staff that comes in has got the adequate training, and we review constantly to make sure that they're up to snuff on their training requirements to make sure that they're doing the surgeries.
Can you talk a little bit about the quality of the medical staff that you're attracting here now? That was another issue that was brought up. Some of the doctors that were here on staff before had questionable marks in their records. What's being done now to weed those kinds of things out, and what kind of success are you having in attracting top medical staff to this facility?
Yes. We have done robust recruitment efforts since I have been here in January of last year, and since then we have recruited over 50 providers, And the way we have ensured is that we advertised all over the nation to attract the physicians who would like to work here, and we have truly great interest in this area, and we have top-notch. And one of the examples is our chief of medicine is an intervention cardiology with several years of experience, and just having him here is attracting other qualified applicants, seeing that such a highly trained and advanced cardiologist is here to help with progressing us forward.
Since you were really putting out the word, since putting out the word that you were really looking for top-notch staff here, how many people have you gained on staff?
About 50. 50, that is right. So we had almost fully staffed now. We also started a new hospitalist program, which was not there before. That means that the hospital will be covered 24/7 by a trained hospitalist who will be immediately available and take care of any issue that arises during that time.
Those 50 new employees, is that a combination of doctors and nurses and support
No,
staff?
it is all providers. There are few mid-level providers, but most of them are physicians. And the physicians are ranging anywhere from primary care physicians, emergency room specialists, including nephrologist, cardiologist, and neurologist. So we have done, all over.
I have a two-part question. I don't know who this is better for. Today's announcement is reinstating standard level surgeries. What levels are the next, and is there a timeline in place to try to implement those back?
As we announced, we'll be going with standard level surgery. This is identified as minimally invasive, although invasive surgery that typically requires an inpatient stay. On the top end of the scale is a tertiary care facility, which we will not be going for. This would be the open hearts, the neurosurgery kind of thing. The intermediate would be everything in between, and our goal is to get that. Time frame for that is, we do not have an established time frame. Our goal is to go with standard, and obviously we will be successful there, but we want to make sure that we have no glitches there, and then we will be presenting our plans for the future to elevate to the intermediate level. Anything else?
Intermediate level is the highest that this facility's been.
I think that, yes, equivalent in the past, this would have been doing intermediate level surgeries.
Can you tell me how much is the Department of Veterans Affairs still watching this facility, and how much back and forth day-to-day contact are you guys having to make sure things are progressing the way you want them to? Because I know some legislators were looking at this place as well.
We're in constant contact. We've got systems in place. The VA nationally has systems in place to monitor and look at metrics that are going across the nation, all the hospitals. We still do routine reports, conversations on how things are going. The national program has been very helpful identifying areas that we need some help on, getting people in here to help us train, for instance, bringing ideas on how to address issues. They've been extremely helpful, and we surely will continue to depend upon them for support. That's one of the advantages of a nationwide system. When we see something that we are not satisfied with, we've got a lot of hospitals we can call to get assistance with that.
Talk about your new plans, these posters. When are we going to see them?
Well, the concept is just been received. This is the building to the east side of the building you're in now. This would add 2 levels to it. This is a 2-phase project. This is our first conceptual drawing, and here's the first conceptual interior look at it. So this will be a 2-phase project. So design is ongoing. Construction would start within the year on the first phase, and the next would start after that. So probably within 4 years we'll have all this completed. As a total right now, we have about $42 million worth of construction going on that I would consider significant at Marion. I think that reflects an investment by the VA nationally in the Marion campus.
In the release, it talks about an independent external review. What types of things do they look at? What's the name of the company that do that?
This would be the Joint Commission. Their full-time responsibility is to accredit hospitals all across the nation, not just the VA.
So it was just the Joint Commission?
The Joint
I
Commission.
didn't know if there was another private sector.
That is the organization that we all strive to meet their standards. We did extremely well on that, and as I mentioned, they did identify best practices in our packages that we do when we are looking for docs and as we monitor their progress.
We also heard recently that you guys have formed a new partnership with a clinic in Evansville. Can you tell us a little bit about that?
Sure. Marion encompasses 52 counties, including Indiana and Kentucky. Evansville is, of course, the biggest population center in that, and we've got a big clinic there now that is our responsibility. Currently, that clinic's about 30,000 square feet. We are in the middle of a construction project that will be finished in the fall that will take that to 90,000 square feet. A significant improvement for services to the veterans of Southwest Indiana and Northwest Kentucky.
Just one quick question, I might have missed it. The top of your press release says, will reopen standard level. I mean, have you guys already done that, or do you have a date, or?
We're ready to go.
You haven't done any surgery?
We haven't done any surgeries yet. We wanted to get today processed very well, and we'll be doing that.
So you guys surgery scheduled for tomorrow?
We don't for tomorrow.
Later this
We will.
week?
Don't know exactly what day it's going to be. I wanted to focus to get Dave to be successful first.
But
We
from
do wanna
today
make-
on, you can do surgery.
Yeah, we want to
Okay.
make sure that we,
Check it.
yeah, we're very anxious to. We want to make sure we protect the privacy of the veterans that have first surgery. We want to make sure that we abide by our responsibility for some privacy there.
I interviewed a veteran this morning who said, I don't know whether to be happy or to be scared.
Well, I think they should be very happy. We're very confident that we're prepared to do surgery here. We want to make sure that we have the trust of the veterans and the community, that we can provide excellent services here, and we are ready to go.